The House will be in order. Pursuant to Clause 8 of Rule 20, the Chair will postpone further proceedings today on motions to suspend the rules on which a recorded vote or the yeas and nays are ordered and on which the vote incurs objection under Clause 6 of Rule 20. Record votes on postponed questions will be taken later. For what purpose does the gentleman from Pennsylvania seek recognition?
Mr. Speaker, I move to suspend the rules and pass H.R. 4302, the Protecting Access to Medicare Act of 2014.
The clerk will report the title of the bill.
H.R. 4302, a bill to amend the Social Security Act to extend Medicare payments to physicians and other provisions of the Medicare and Medicaid programs and for other purposes.
Pursuant to the rule, the gentleman from Pennsylvania, Mr. Pitts, and the gentleman from New Jersey, Mr. Pallone, will each control 20 minutes. The Chair recognizes the gentleman from Pennsylvania.
Mr. Speaker, I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and insert extraneous materials in the record on the bill.
Without objection.
Mr. Speaker, I yield myself such time as I may consume.
Gentleman's recognized.
Mr. Speaker, I sorely wish I were here getting ready to vote on a bill that would permanently repeal and replace the sustainable growth rate. In this chamber, we passed a bill that would do that and that would have fully offset the cost of the repeal by delaying a provision of the Affordable Care Act that the administration just keeps delaying themselves. In fact, it was partially delayed again just yesterday. Unfortunately, we have reached another doc fix deadline. I believe that we must act to protect America's seniors and ensure that they can continue to see the doctors who they know and trust. And that is why I have introduced legislation that represents a bipartisan, bicameral agreement that will give us additional time to work out our differences and pass permanent repeal. We are closer than ever to reaching that goal. We have an agreement on policy. We need to overcome our differences about the responsible way to pay for those new policies. I hope that we can act before we reach the new deadline of March 31st, 2015. In fact, we should try to reach a bicameral agreement before the end of this Congress. I am glad that Speaker Boehner has offered his continuing support to this effort. With the House having acted, we hope that the Senate can also pass an SGR repeal that has real pay-fors. Then we can begin the process of working through our differences in a conference committee. I'm sponsoring this bill today because it is my earnest hope that this is the last patch we will have to pass. And I urge all of my colleagues to support this bill, and I reserve the balance of my time.
Gentleman reserves. Gentleman from New Jersey.
Thank you, Mr. Speaker. I yield myself such time as I may consume.
Gentleman's recognized.
Mr. Speaker, I'm sorry, but I simply cannot support yet another temporary SGR patch. This bill is bad for seniors and it's bad for doctors. We want to achieve a permanent solution to this ongoing problem. This bill does nothing to achieve that goal. In fact, it sets back months and months of hard work. What we should be considering today is the bipartisan, bicameral agreement that my colleagues and I developed. That bill is what doctors' groups and patient groups support. That bill can also be offset without robbing one provider to pay another provider. What's before us today doesn't fix the problem. It exacerbates it. We had a true opportunity to finally accomplish what our constituents have asked us to do for a decade, and that's passed a permanent repeal of the SGR. But the Republican leadership is letting that opportunity slip away. And I respect my colleague from Pennsylvania, but I don't believe that if we pass another patch that we're going to go back and do a permanent fix. My fear is by doing this, we will lose the opportunity to do the permanent fix, and it simply slips away. 2 weeks ago, Republicans brought to the floor our agreement, but they added a poison pill offset that they knew the President and the Senate would never accept, a delay of critical Affordable Care Act provisions. And all that accomplished was wasting time. And that has led us to this scenario, spending another nearly $20 billion on a patch. Meanwhile, this bill includes health policies that have never seen the light of day. Some have been used as offsets, others as sweeteners to get members to vote for it, but I'm not falling for it. That is no way to govern. The Senate is actually poised to vote on our bipartisan agreement that is fully offset. It does so without cutting from the healthcare system, and that is the bill we should be considering here today. Seniors do not want us to kick the can again for another year. The doctor community spoke loud and clearly yesterday, no more patches. So I ask my colleagues, let's not go down this road again. Instead, let's come together and pass a permanent solution. Let's get the job done. Vote no on this bill. And I reserve the balance of my time, Mr. Speaker.
The gentleman reserves. The gentleman from Pennsylvania.
Mr. Speaker, at this time I'm pleased to yield 2 minutes to the gentleman from Florida, an important member of the Health Subcommittee, Mr. Bilirakis.
The gentleman from Florida is recognized for 2 minutes.
Thank you, Mr. Speaker. Thank you, Mr. Chairman. The SGR cuts would reduce doctors' compensation for treating Medicare patients by 24%. Seniors and physicians cannot afford that, and Congress cannot let it happen in 5 days. The legislation before us would patch the SGR for a year. I support this legislation, of course, reluctantly. 2 weeks ago, the House passed a permanent repeal and replacement of the SGR that was fully paid for. The fix provided doctors who treat Medicare patients with certainty. That's what they need, and incentivized and rewarded doctors to keep seniors healthy. The Senate needs to negotiate, Mr. Speaker. If they don't like the House pay for, come up with one. Let's come together and get this done. A patch isn't the best solution. We can replace the SGR, but the Senate has to work with us. Again, let's get this done. Let's work together and get it done for our seniors. Thank you very much, and I yield back, Mr. Chairman.
The gentleman yields back. The gentleman from Pennsylvania reserves. The gentleman from New Jersey.
Mr. Chairman, Mr. Speaker, I now yield to the gentleman from Washington, Mr. McDermott, 3 minutes.
The gentleman from Washington is recognized for 3 minutes.
Mr. Speaker, Winston Churchill apparently once said, "Americans will always do the right thing, but only after they've tried everything else." Then again, Churchill never tried to fix the doc fix in the United States Congress. For 10 years, we've been trying to fix the sustainable growth rate in Medicare. And for 10 years, we have kicked the can down the road with 17 different short-term pass votes. The Protecting Access to Medicare Act of 2014 is a mixed bag of some important compromises, like ensuring that there's an accurate valuation of services under the physician fee schedule, some problematic provisions such as the end renal stage disease policy, and some provisions that have never been vetted in front of the Congress, in front of committees at all. And more importantly, this bill represents our 18th failure to rebuild the bedrock of the Medicare program. Our 18th failure to provide American seniors with the safety and security of a permanent fix to the SGR. That's why the AMA is voting no on this bill. That's why most physicians groups are strongly opposed to this bill. Last night, my office was flooded with messages from various physician groups. I, for one, still believe in finding the way to do what's right. I, for one, am dedicated to the principle of seizing the moment and accomplishing big things on behalf of the American people. We thought we were going to do it this time. So when it comes to this mixed bag piece of legislation, cooked up in the dead of night, put on the web at 2 minutes before 12 a couple of days ago, revised several times since, not much more than 48 hours ago this stuff started. I vote no. Enough with trying everything else. It's time to do what's right. A permanent doc fix. Argued, debated, and agreed upon in what our seniors need. It's what our doctors need to help them manage their practices. It's what our nation needs and deserves. I yield back the balance of my time.
The gentleman yields back. The gentleman from New Jersey reserves. The gentleman from Pennsylvania.
Mr. Speaker, before I yield to the chairman of the Energy and Commerce Committee, we have groups in support who've expressed support for this bill: the American Clinical Laboratory Association, American College of Radiology, Easter Seals, Family Research Council, Juvenile Diabetes Research Foundation, Medical Imaging and Technology Alliance, MIDA, National Abstinence Education Association, Pennsylvania Partnership for Children, Pew Charitable Trust, 0 to 3, National Center on Infants, Toddlers, and Families, AdvaMed, among others. And I would urge members to seriously consider this. And at this time, I'm pleased to yield whatever time you may consume to the gentleman from Michigan, the chairman of the Energy and Commerce Committee, Mr. Upton.
The gentleman from Michigan is recognized for such time as he may consume.
Well, thank you, Mr. Speaker, and I thank the distinguished chair of the Health Subcommittee, and I have a statement for the record, which I'll ask unanimous consent to submit for the record. Mr. Speaker, here we are at the very end of when the doc fix expires, March 31st. That's next week. We have tried in a very responsible way for many months to try and resolve this issue, and I commend my friend Mr. Waxman and others when we passed our bill out of committee last summer, 51 to nothing. I think it was Speaker Boehner that said he didn't think we could honor Mother Teresa for sainthood with a vote like that. I commend my good friend Mr. Camp from Michigan and Sandy Levin, gentleman from Michigan, on the floor now, as we work together and worked with the Senate as well to actually lock in place a bill on literally the last day that Chairman Baucus was in the United States Senate to try and resolve this. And we knew all along that we were going to have a pay-for. And here in the House a couple weeks ago, we passed a bill, somewhat on partisan lines, I know, so not 100% on either side, but we passed a 10-year fix with a pay-for. Now, I had a great 9th grade civics teacher, Mr. Denicus. He's no longer with us. He's with the Lord. But I'll tell you, as I sit down with my students, as I did this week, a lot of them are here in town, my close-up groups and others, and speak to my high schools and colleges, they know there's never such a thing, maybe, as a perfect bill. And one of the first lessons in civics is that you pass a bill in the House, you pass a bill in the Senate, they're always different. You go to conference, you work out the differences, it comes back. Nobody wants this expiration of the doc fix. Nobody. It hurts our physician community. They care about the folks that they treat. Literally, they're going to have almost a 30% reduction cut in the services that they provide as early as next week. But let's think about our most vulnerable too, our seniors. They've got those doctor appointments. They want to be there, and maybe with a 30% cut, those physicians will say, gosh, we just can't do this. That appointment is canceled. We're going to just stop serving Medicare patients, period. Those over 65. We don't want that. We don't want that hurting our most vulnerable. So we passed here in the House a couple weeks ago a 10-year bill. The response from the Senate is nothing. Yes, we've had some discussions. Talked to Ron Wyden, former member of our committee. He's diligently trying to get something done, but they've got no bill ready for passage on the Senate floor that either matches what we did to go to conference. They've got nothing. There's a lot of talk about maybe just doing a bill without a pay-for or some phony savings. That's not what this House is about. It's a lot of money. And we have some rules in the House that you got to have a pay-for it. And that's the real difficulty in trying to get things done. So, here we are at the end of the week. The cuts come in next Tuesday, April 1st. So, we're trying to send another offer to the Senate. You're not going to take the 10-year fix? Let's try a 1-year fix. It is paid for. It's about $20 billion. A number of little provisions that are in there that I think are important. Again, working with all sides. And, last night we were somewhat surprised. A number of groups that came out against it. But the alternative is the door gets shut. We don't have a backup plan. All right? This is the bill. And if we can get 290 votes, everybody's here. 2/3 vote, that's great. We'll send yet another offer to the Senate, and they can choose either one. They can take our 10-year bill. They can take a 1-year bill. They can pass something different, and we can come to conference. And I must say that this bill, now it's a 1-year bill, it doesn't stop us from still trying to negotiate something for a permanent fix, because that's what every one of us wants. It doesn't stop us from getting that done. But at least it stops what otherwise will be the denial of services to the most vulnerable, our seniors, who may not understand what's happening. It continues the process to move forward. So we've got a couple options that we're teeing up, but obviously we have to pass it today here with a 2/3 vote and let the Senate decide which alternative, or pass something else, but pass something so that we can go to conference. But if that happens, then the doc fix is not fixed, and for however long that period is, the cuts come into place. So, it'd be nice if we could actually pass this by voice. What do you think? It'll get us off the dime, and again, we'll toss it to the Senate to try and get it done. No one wants it to expire, but without one of these two bills, it expires. And we don't want that to happen. So I would urge my colleagues on both sides of the aisle, my friend Mr. Pallone, my friend Mr. Waxman and others, yes, we need to get this thing done. It is the best that we can do right now, and there's not a plan B for next week. I yield back the balance of my time.
Gentleman yields back. The
Reserve.
gentleman from Pennsylvania reserves. The gentleman from New Jersey.
Mr. Speaker, I yield 3 minutes to the gentleman from Oregon, Mr. Blumenauer.
Gentleman from Oregon is recognized for 3 minutes.
Thank you, Mr. Speaker. Thank you, Mr. Pallone. I cannot express my disappointment with the proposed additional temporary patch to the sustainable growth rate, the SGR, the doc fix. This was a contrived solution from the very beginning, and it's morphed into a shameful annual ritual disrupting the provision of medical services in this country as the parade of medical professionals come to Washington, D.C. to plead with us to not do something crazy. It's simply, today, an accounting sleight of hand. It is a power play and a fundraising tool, to be sure, that disrupts the practice of medicine. But we have absolutely no intention of ever having the SGR cut occur. It may bite for a day or two, but we're not going to allow a reduction on that order of magnitude. We will find some sort of adjustment, as we always have, that will not be satisfactory and will continue the uncertainty and the indignity that is inflicted on people in the healthcare space, and more important, on the people that they serve. If you want to actually cut healthcare spending, we could do so. And if we would stop this charade of meaningless gestures of repealing the Affordable Care Act and actually get down to cases, fine-tuning and moving forward, we would be there. There are a range of potential savings within the healthcare space that is acknowledged by virtually everybody in the industry and every expert that's looked at it. But it can't be done in a cavalier fashion according to some ritualistic formula, and it can't be done overnight, and it's going to require a steady hand, including politicians acting like grown-ups. In the meantime, I think it's important to stop this travesty. Remember, when we had a similar pointless exercise with the alternative minimum tax, realizing that the supposed savings were not real, that the full bite would never take effect, what did we do? We finally reset the budget baseline and moved on. And that's exactly what we should do with the SGR. And then deal meaningfully with the adjustments in accelerating healthcare reform, not a 54th time to repeal the Affordable Care Act. We should be rewarding people who are providing high-value care and finding ways to be more efficient, and adjusting the system to slowly squeeze out our areas of inefficiency. It won't be easy, but it is definitely within our capacity, and it is already starting around the country. Maybe Congress should consider debating this issue with an open rule, allowing everybody to come to the floor to speak, to offer amendments, to debate it fully, and see what we can come up with. It won't be any worse. Let's end this charade, give the healthcare space some certainty, and get down to work being a full partner in the reform and enhancement of our healthcare system.
A gentleman has expired. For what purpose does the gentleman from Pennsylvania
Speaker,
seek
may I
recognition?
inquire of the time?
The gentleman from Pennsylvania has 10.5 minutes. The gentleman from New Jersey has 12.5 minutes.
Could I inquire of the minority how many speakers they have left?
I have at least 2 left.
Okay, I'll reserve.
Gentleman from Pennsylvania reserves. The gentleman from New Jersey.
I yield now 3 minutes, Mr. Speaker, to the ranking member of the Energy and Commerce Committee, Mr. Waxman.
Gentleman from California is recognized for 3 minutes.
I thank the gentleman for yielding to me, Mr. Speaker. Today, Congress will vote on yet another patch to the Medicare physician payment system, but it should not be that way. We need a permanent fix. Earlier this year, we seemed on track for a permanent fix. We reached a bipartisan agreement on what a permanent fix should look like. That bill was introduced by both Republican and Democratic leaders, Mr. Camp, Mr. Upton, Dr. Burgess, Mr. Levin, myself, and Mr. Pallone, and Senator Baucus and Senator Hatch. That bipartisan bill is broadly supported by the physicians and the patients' groups. That bill would not cut providers or beneficiaries to fix payments to physicians, and that bill would fix this problem permanently. The bill before us today is not a permanent fix. It's a short-term fix. 2 weeks ago, Republicans brought up the bipartisan bill for the permanent fix with a poison pill offset that undermines reform for low-income families. That was 2 weeks wasted where we could have worked towards a permanent solution. I've heard my Republican colleagues say it's too hard to find offsets, or we don't have enough time to come up with the offsets to get a permanent bill done. Let's not forget, Republicans do not insist on offsets for things they really care about. Trillions in tax cuts for the wealthy? No need to offset that. A Medicare prescription drug bill that costs far more than this permanent fix to the SGR? No need to offset that. But when we talk about protecting seniors' access to their doctors, their answer is different. Mr. Speaker, I would urge that in the end, this is a vote members will need to make up their own minds about. We may end up being forced to support a short-term patch, but I'm not ready to concede that yet, so I'm not ready to support this bill that's before us. Let's keep working on getting a permanent solution, and I yield back the balance of my time.
Gentleman yields back. The gentleman from Pennsylvania is recognized.
I'll continue to reserve.
Gentleman from Pennsylvania continues to reserve. The gentleman from New Jersey is recognized.
Mr. Speaker, I yield 3 minutes now to the ranking member of the Ways and Means Committee, Mr. Levin.
The gentleman from Michigan is recognized for 3 minutes. Without objection.
So let me describe briefly the challenge before us. This bill is very disappointing. The 3 committees have worked on a bipartisan basis to put together a bill that would address once and for all SGR and would reform the payment system. Indeed, it would transform this bill that we worked on a bipartisan basis, the physician payment system, into one that's more acceptable for high-quality care, rewards value, and provides needed stability for providers and beneficiaries. The bill has a much larger cost than this patch, though patches themselves are expensive. But I want, in response to the gentleman, the Chairman of Energy and Commerce, to make a few comments. There has been no serious discussion all of these weeks about how we would pay for the permanent fix. There just has been a derogation of responsibility. Also, what's happened here is a product that hasn't gone through the legislative process, this patch. Instead, it's a complex $20 billion bill, no public airing, no committee hearings, no regular order. The draft of the bill became publicly available at midnight Tuesday, and there were flaws, so it was refiled, and we got this bill just, 24 hours ago? And this present legislation contains a completely new, unvetted lab payment system. It undermines delivery system reforms for dialysis patients. It includes promising policy to hold nursing homes accountable for patient care, but fails to include key protections to minimize discrimination against certain patients. So look, in a few words, we deserve better and we need to do better. As a result, a large number of physician groups have expressed their opposition to this. So what this bill does today is miss the opportunity to do full-scale repeal and replace the physician payment system. The Senate still needs to vote on a permanent fix. The Chairman of Energy and Commerce said, well, we passed that kind of a bill. Yes, the 10-year fix was a partisan bill that had no chance of passage in the Senate. Zero chance of passage. The Senate still plans, as I understand, to vote on a permanent fix. We should let the Senate process unfold. We have more time to get this right. We do not. I ask for an additional minute. I ask for an additional minute from Mr. Pallone. I ask for an additional minute.
Yield an additional minute to Mr. Levin.
The gentleman is recognized for an additional 1 minute.
So we have more time to get this right. It is not correct that if we don't act today that there will be any impact on seniors. We could let the Senate act to try to do something permanently and come back next week if we have to and take up this bill. So this is the challenge before us. We're here once again doing something that's very temporary, that's very, very expensive, and we are failing to step up to the plate on permanent reform and a permanent fix, and doing it with a legislative process with a product that has not gone through committee, has had no public hearings, has had no real airing. We should not be acting blindly. I yield back the balance of my time.
Time of the gentleman from Michigan has expired. The gentleman from Pennsylvania is recognized.
Mr. Speaker, I continue to reserve.
The gentleman from Pennsylvania continues to reserve his time. The gentleman from New Jersey is recognized.
Mr. Speaker, I yield 1 minute to the Democratic leader, Ms. Pelosi.
The gentlewoman from California is recognized for 1 minute.
Thank you very much, Mr. Speaker. I thank the gentleman for yielding. I thank him for his leadership on issues that relate to the health and well-being of the American people. I also commend the leadership of previous speaker, our ranking member on the Ways and Means Committee, Mr. Levin, as well as that of Mr. Waxman. They have been two champions on the subject of health care in America and doing so in a fiscally sound way. And while I appreciate the concerns that they expressed here, and I share them, and I will speak to that, I do think that we have to think carefully about the decision that we make. I know that they have. This is an example. The leadership bringing this bill to the floor on the short fuse that the expiration date is March 31st, without most people in this room having ever seen what is in the bill, is a missed opportunity. We should be considering right now a bill that would permanently speak to the SGR. For those in the public, I know it's inside baseball talk, SGR, that is the rate that docs are compensated for treating Medicare patients. So don't think of SGR, think of the patients. And that's what we're doing here. Think of the certainty that they need in terms of their health care, and that is our seniors. Think of the certainty that a permanent fix, paid for or not, but let's say paid for, would mean to remove the uncertainty from this debate. The American Medical Association is opposed to this bill that is on the floor today because it is a patch. How many times have you heard people talk about a Band-Aid? We're just putting a Band-Aid on it. We're not getting to the underlying challenge that we face. This is a Band-Aid, and that's why the docs oppose it, this patch. Now, I did hear the distinguished gentleman from Florida, Mr. Bilirakis, said, if you don't like these pay-fors, suggest your own. Well, we have suggested our own. It's called OCO. It's called OCO, the Overseas Account, and the Republicans said that's a gimmick, but it wasn't a gimmick when you put it in the Ryan budget. It's in the Ryan budget. So it works for you where it works for you, but you don't want to put it to work for America's seniors. So here's the thing. The Senate majority and the House majority came together to produce this patch, this Band-Aid. It's the wrong way to go. It does not address the underlying problem. We could have done that. We've been trying to do it for 10 years. And it's always, always, always something that the Republican majority has backed away from and limited and done on a short fuse. There's so many things that are wrong with this bill. But the simple fact is that the clock is ticking, and on March 31st, it's bad news for seniors and for the doctors who treat them in the Medicare program. Our seniors depend on Medicare. They depend on Medicare, and this is a weakening of it. So it's just the same old, same old. Let's see what we can do to find some pay-fors that really undermine the health and well-being of the American people. Those same pay-fors, done properly, could be part of a permanent fix, but instead they're part of the Band-Aid. So this is all to say to my colleagues, you're going to have to make your decision as you weigh the equities. Is it better to just succumb to what we have, no matter how mediocre and how missed an opportunity it is? Or is it better to say, let's hold out until our Republican colleagues agree to the full SGR, essentially a fix forever, paid for by OCO. It's really important to note the following. The shorter the fix, the more expensive it is. We've been seeing that year in and year out. If we had dealt with this, say, 6-7 years ago, it would have cost much less than it is to patch 1 year to the next, sometimes less than a year to the next. So this is not about reducing the deficit. It's not about the good health of the American people. It's just an ideological reality that we have to deal with from the Republican side of the aisle. So when the docs, the AMA, says we're opposed to this, vote it down, that's important to us. I say to them, talk to your Republican friends. They have the power to do a permanent fix paid for by OCO. They refuse to do it. So we have something less good that we can do for the American people. And if this sounds a little confusing, it's because it is. And members have to make the decision as to whether they will vote for this just because we're forced into it, or whether they want to hold out for something much better. This would be a more appropriate debate a month ago, where the clock does not run out over the weekend. But this is a tactic, it's a technique used by the majority to force the hand without the proper weighing of equities in all of it. So my colleagues, I just urge you to try to weigh those equities. I myself come down on the side of supporting the legislation because, frankly, I believe that any uncertainty in the minds of our seniors about their ability to see their doctors will certainly be, the Republicans will say, this is because of the Affordable Care Act. And I just don't want to give them another opportunity to misrepresent what this is about. If the Affordable Care Act never existed, we would still be here debating SGR. They are two separate subjects. But as we know, any excuse will do to undermine the great legislation as the Affordable Care Act. It was about life, a healthier life, the liberty of people to pursue their happiness because they have the freedom to do so. Better quality, lower cost, more accessibility. So that's how I come to the conclusion of, let's not give them another false claim. Let's just get this done. But let us not give up on the prospect of, even before this expires, of having a long-term permanent fix to SGR. It makes all the sense in the world. It has no partisanship about it. It is sensible, and it will cost less to do more for our seniors. The challenge is there. The solution is clear. The Republicans have rejected it, so we're at their mercy. My conclusion is to vote yes. Members will have to come to their own conclusions on it. I frankly wish that the Republicans, in their power, would have brought the bill to the floor under rule so we could have a proper debate on it instead of requiring a 290 vote requirement to pass it. With the shortness of receiving this information, only this morning members are finding out what it is, it's really hard to predict who will vote pro, who will vote con, who will vote aye, who will vote no. But this is really a silly decision to bring this to the floor in this form when we know the path that is much better. But I'm not going to give you another reason to go out there and make your claims about the Affordable Care Act, which have no basis in fact. With that, I urge my colleagues to pray over it, as I will, and yield back the balance of my time.
The time of the distinguished minority leader has expired. The gentleman from Pennsylvania has 10.5 minutes remaining. The gentleman from New Jersey has 5 minutes remaining. The gentleman from Pennsylvania is recognized.
I inquire of the minority how many speakers they have left. We're prepared to close.
At this time, I have one more speaker.
I'll continue to reserve.
The gentleman from Pennsylvania continues to reserve. The gentleman from New Jersey is recognized.
And Mr. Speaker, I yield 2 minutes to the gentleman from Connecticut, Mr. Courtney, a member of the Armed Services Committee.
The gentleman from Connecticut is recognized for 2 minutes.
Thank you, Mr. Speaker. Mr. Speaker, I just wanted to follow up on a point that Leader Pelosi just made regarding the OCO account, the Overseas Contingency Operations account, which at Armed Services we are dealing with actually right now. The President came over with his OCO request for this year of $80 billion. This funds the troops over in Afghanistan, the 34,000 that are still fighting courageously to defend our country. At the end of this year, the projection is that troop level will be brought down to, at the highest level, of 10,000, possibly even lower, and combat missions, for all intents and purposes, are going to come to an end. As the Congressional Budget Office has demonstrated over and over again, they will score savings with the OCO drawdown that's going to happen at the end of this year. Indeed, the Ryan budget has used those OCO savings to help balance its own priorities. So this is not funny money. This is not hypothetical. Anyone who's been on a Codell over to Afghanistan knows we're spending money over there, and starting next year, we're going to spend a lot less money because of the change in our deployments over in Afghanistan. The cost of a permanent fix to SGR is $135 billion over the next 10 years. You only need a portion of the OCO account to permanently fix SGR, and everybody who has even come close to discussing this issue knows that in this building. And hopefully the Senate, when they take this up next week, are going to move forward with a permanent fix using totally valid, verified savings by the Congressional Budget Office in the OCO account. It is a peace dividend in terms of drawing down from Afghanistan that we can finally stabilize the Medicare system by making sure that fees are not going to be subjected to this annual cliff that, again, denies access in far too many cases in doctors' offices all across the country. So, again, I just want to emphasize the point. It is not like we are powerless here to come up with an SGR fix for which there is bipartisan support using verifiable, valid savings by the Congressional Budget Office in the OCO account. Our brave soldiers are going to be drawing down closer to the end this year to zero. We can use those savings to fix America's healthcare system. I yield back the balance of my time.
The gentleman from Connecticut has expired. The gentleman from Pennsylvania is recognized.
Mr. Speaker, I'm prepared to close. I'll continue to reserve.
I still have 3 minutes, Mr. Speaker.
Yes, the gentleman from New Jersey has 3 minutes.
So
remaining.
I'll go first, and then, okay. I yield myself such time as I may consume.
The gentleman is recognized.
First of all, Mr. Speaker, I'd like to point out, and I'd like to ask, entered into the record, a letter from the American Medical Association and many, many other physicians groups, as well as state medical societies, in opposition to the legislation. And let me just read the first paragraph. It's addressed to the Speaker and to the Democratic leader. And it says, on behalf of the undersigned physician organizations, we're writing to express our strong opposition to H.R. 4302, and we urge you to vote against the bill when it is considered on the floor. And again, that's from the AMA, many specialty doctor groups, and a number of state medical societies. I would also point out that it is my strong belief, and I know that my chairman of the subcommittee disagrees on this, but it is my strong belief that if this bill passes, that we will not have an opportunity to bring up the larger permanent fix. We will not negotiate that. I doubt very much that that would be the case. I would now reserve the balance of my time and yield 1 minute to our Democratic whip.
I thank the gentleman for yielding. Perhaps we ought to have a criteria of everybody who's read this bill can vote on it. My bet is there would be very few members who would be able to vote on this bill. This is an 8-page summary of this bill with probably 50 paragraphs in it about changes that have been effected in the Medicare system. None of us know what the substance of this bill is. We had a lot of rhetoric in 2010 about reading the bills. I challenge any member to come up here and say, I have read this bill. I am for a permanent fix in the sustainable growth rate for doctors. I have pledged that for the last 4 or 5 years. We have a bipartisan agreement to effect that exact end. But as so often is the case, we do not have the courage to rationally fund that agreement. That is why America is in trouble fiscally. This is a game unworthy of this institution and of the American people.
Mr. Speaker, I would yield the balance of our time to the Democratic whip.
The gentleman from New Jersey has 45 seconds remaining. That time will be yielded to the gentleman from Maryland.
I thank the Speaker. It is unfortunate that we have been put in this position with less than 48 hours notice of what's in this bill. to do something that all of us know needs to be done. The doctors of America, at least the organized doctors of America, have said vote no on this bill. Because they know, we know, the Wall Street Journal knows. We have to fix this permanently, not patch it every year. It's a fraud. And both sides have committed that fraud. And we ought to stop it. We ought to fix this. Americans ought to expect us to fix it. The doctors expect us to fix this. Seniors expect us to fix it. What a lamentable fact that we cannot summon the courage and the judgment and the wisdom to do just that.
The time of the gentleman from Maryland has expired.
I yield back the balance of my time that I don't have.
All right, the gentleman from Pennsylvania is recognized, and he has 10.5 minutes remaining.
Mr. Speaker, I want to read out the title of a blast that I just received from the Heritage Foundation. Some of our members might be interested in this. Quote, "A temporary SGR patch is better than permanent deficits," in support of the bill. My colleagues, this morning, seniors are watching. This is not a game. We are thinking of seniors and certainty for them. A vote no today is a vote against seniors. We are not voting for the AMA today. We're voting for or against seniors today. We will continue to work with all of our might for a permanent repeal of SGR. We've worked on this for 3 years. We must get there as soon as possible. But we're at a deadline. And this is the last vote we will have. And if you vote no on this bill, you're voting for more uncertainty. You're voting for a cut to doctor reimbursements. You're voting against seniors. Let us vote for seniors this morning. Vote for H.R. 4302, and I yield back the balance of my time.
The gentleman from Pennsylvania has yielded back, all time having now expired on this bill. The question is, will the House suspend the rules and pass the bill H.R. 4302? Those in favor will say aye. Those opposed, no. No. In the opinion of the chair, 2/3 being in the affirmative, the rules are suspended. The bill is passed, and without objection, the
Mr.
motion
Speaker.
is laid on the table.
Mr. Speaker.
Pennsylvania. Gentleman from Pennsylvania is recognized.
I object to the vote on the grounds that a quorum is not present. Make a point of order that a quorum is not present.
Pursuant to Clause 8 of Rule 20, further proceedings on this motion will be postponed.